Welcome to On Cue. I'm Michael Bartley. Most people think of childbirth and later breastfeeding as two very natural acts, but women used to learn how to breastfeed their babies from their sisters, mothers, aunts, and grandmas. But a few generations ago, breastfeeding fell out of favor, and for many, the generational ability to teach younger women was lost. So, what are new moms supposed to do now? Well, here in Pittsburgh, we have a unique resource, a breastfeeding center that's helping women from all over the tri-state area learn a skill that's kept the human race alive for millions of years. On Cue's Tonya Caruso reports.
Okay, Megan, so you're comfortable with the plan that we developed for you today?
Yes.
If you're having any other concerns with breastfeeding, you can give us a call any day.
Okay.
And we can talk about
Many people think it would be the most natural thing in the world and wonder why would any woman need help in learning how to breastfeed her baby.
What used to occur between mother to mother and aunts to nieces and grandmas, there used to be a natural sort of learning that occurred. Doesn't occur anymore because of the low breastfeeding rates we've had. So they come here to find out what they need to learn to do this natural activity.
Here is the Breastfeeding Center of Pittsburgh. You'd never know that this nondescript office in a strip mall in Squirrel Hill is a resource unlike any other in the country.
We have 6 physician, internationally board certified lactation consultants. Those are called IBCLCs. We also have a pediatric nurse practitioner IBCLC and 4 additional IBCLCs. So we have a total of 11. There's nothing like us nationally.
And you tend to say, well, just give formula, because nobody likes to admit their own ignorance.
Todd
Yeah,
Wolynn is executive director of the Breastfeeding Center of Pittsburgh, and Dr. Nancy Brent is the medical director. And besides teaching new mothers the proper techniques of breastfeeding, the center also teaches physicians and trains lactation consultants.
Breastfeeding is by far the best thing that you can do for your baby to prevent infection, to reduce allergies, potentially to reduce obesity, cancers.
For mother, it also protects against breast cancer, as well as ovarian cancer. It helps her to lose weight more quickly. And there's even some evidence that although there's a drain on the body during the feeding, the bone health is the same or better in women who breastfed.
People know that they should do it, but there's really no good support. And more importantly, their primary care physicians, whether it's their pediatrician or whether it's their family practice doctor, they're very uncomfortable with the concept of breastfeeding. Lactation consultants, on the other hand, are the main resource of support.
And while it's natural and has a multitude of benefits, breastfeeding isn't always easy. New moms can encounter problems.
Probably the most common are pain with breastfeeding, low milk supply, baby's weight being of a concern, and sometimes it's no problems, it's just first-time moms not being sure if things are going well, and they just want to make sure that everything's going well for them and their babies.
My concern was just, making sure that my son was gaining weight and things like that, and just wanted to have as much support as possible.
This is my first baby. This is Claire. She was born 4 days ago, and we just came in for her well baby appointment today, and also a lactation consultant because I was having some trouble getting started with breastfeeding, but that was something that was really important for me to do.
Most of the center's lactation consultants breastfed their own babies, and their struggles led them to help others.
I had a lot of problems with breastfeeding 25 years ago, very little help in the community back then, and with the help of some wonderful women over the phone, they kind of guided me through my problems and realized as time went on that I wanted to be able to help mothers to breastfeed.
I know we still have some things that we're going to continue to work on. And we're here in the office, they affectionately call me Booby Judy.
Judy will tell you that for all of its benefits, there is still a stigma around breastfeeding.
We use breasts to sell everything in this culture. If you just watch TV or look at billboards, you will see them everywhere. Alcohol, cigarettes, Levi jeans. So we use them to sell everything, but when people see a baby at the breast and there's a little bit of breast showing and it typically isn't much, it's this little piece of skin, then they get offended. So it's just kind of silly.
It took 12 years, but Harrisburg finally passed legislation allowing breastfeeding in public. And Pennsylvania still lags behind other states in the number of mothers who initiate breastfeeding.
We actually have some counties with initiation rates as low as 40%. In Pittsburgh, I think we're in the mid-60s.
The Breastfeeding Center of Pittsburgh owes its birth to Dr. Nancy Brent, who used to work at Mercy Hospital.
We all had to do a research project, and at that point I was just a general pediatrician, and I thought, what do I know about? And from my own children, I knew about babies who didn't sleep and babies who breastfed. So I decided to do a project on encouraging low-income women to breastfeed. The survival of the human race is dependent on breastfeeding, but in recent history, when proprietary formula became a safe alternative, more and more people started to use it. And in this country, the breastfeeding rate dropped to its minimum rate in the 1970s. It looks great. Really terrific.
So Dr. Brent decided to promote breastfeeding through what she calls her grand plan.
I hired a lactation consultant who then worked at Mercy for a number of years, and between us we developed a breastfeeding curriculum for our pediatric residents.
Dr. Brent's residents graduated as internationally board-certified lactation consultants, and Todd Wolynn was one of Nancy's brightest residents.
The idea was these residents would go forth bringing their breastfeeding information throughout the nation, and unfortunately I hired them all.
They joined Todd in a local pediatric practice. Then, in 2006, the group decided to open the Breastfeeding Center of Pittsburgh.
They asked me to join them, and that was what I've done since then.
Now, the center is getting its message to the corporate world. New mothers are re-entering the workforce in greater numbers than ever before. And HR executives find that working with the Breastfeeding Center helps their bottom line.
For every dollar spent, they have more than $1 return to the corporation in the form of greater productivity, greater satisfaction, reduced absenteeism, and the mothers feel a heck of a lot better about their workplace when they have a supportive employer as well.
Okay, let's go in. I breastfed Violet for the first 6 months of her life. I'm Rebecca Bourne, and this is Violet Eileen, and she's 19 months old. I did come back to work when she was about 3 months old, and because of the support of management and the environment, I was able to pump at work, to close my office door and place a note on the door, and that really worked.
The mantra now, even used by the formula reps, is breast is best, knowing that you can't fight the evidence anymore.
It's a way that we can be really close and kind of be getting to know each other at this point.
And when it's working, it's a great feeling. You know, it's a closeness that I know, no one else can have.
It's the most normal, natural thing in the world, but it also is a learned art.
And sometimes you just need a little help.
All done.
The Breastfeeding Center has 2 offices, one in Squirrel Hill and the other is in Pleasant Hills. They are working hard to promote nursing. Now, the center is trying to help the Pittsburgh region reach the guidelines issued by Healthy People 2010. That's a program of the U.S. Department of Health and Human Services. The goal is to have at least 75% of all new mothers breastfeed. And there is more information on that on our website at wqed.org/onq. And just last week, a new study appeared in the Journal of Pediatrics, and according to the authors, Michael, they say breastfeeding can reduce the risk of SIDS, or sudden infant death syndrome, by up to 50% in some cases. They're not exactly sure why, but they do know that breastfeeding has a real impact on the health of a child.
And it's amazing, depending on where a new mother works, that workplace, they have to be supportive.
Absolutely.
All right, Tonya, thanks so much.